All right, hey everybody. So today I want to make kind of a different video. I have another guest on my channel for the second time ever. We have Dr. Frank Hahn here. Dr. Hahn, do you want to introduce yourself?
So I'm Frank Han. Thank you for the opportunity to have this conversation with you. And professionally, I am a pediatric and adult congenital cardiologist. And so what that means is I deal with the heart issues of kids and if they had heart issues when they were babies and if those patients grow up to later be adults, that's what the adult congenital pieces. So it's heart conditions that people were born with throughout their lifespan.
And that's exactly why I wanted to have you to have this conversation today, because we're going to be talking about this case report, which appeared in Legal Medicine Tokyo. It's a really sad case report, and I think that, well, I know that already some anti-vaxxers have tried to take advantage of this story and frame it in a way that furthers their agenda. But I think you and we can have an honest conversation about what the facts show, what we can learn from it, what we need to learn more about, and how we can contextualize these findings within the broader literature. So, how about we just get started talking about it? This is a case of fatal multi-organ inflammation following a COVID-19 vaccination. Essentially, what happened here is a 14-year-old girl very tragically and unexpectedly died 2 days after having her third dose of Pfizer mRNA COVID vaccine. And you are probably better suited than I to explain the findings of the autopsy that these authors did. So, can you quickly go over kind of what they found and what it means?
So the most important, well, the one relevant to myocarditis is going to be the biopsy that they did on some of the heart tissue. I think by their description, they biopsied various areas, but the figure one has a uh, small section of the left atrium that was stained using CD3 and CD68, which are, for the audience members, ways to show that there are inflammatory cells in the inside the whatever tissue that you're looking at. And then H and E is short for hematoxylin and eosin, and so those are traditional stains that you can think of like a baseline regular flavor way of just to get an overall survey of the tissue. They actually did heart, lungs, liver, kidney, diaphragm, and stomach and duodenum. And for their full list of biopsies that were included on the paper, the other biopsies outside of the heart are what they used to establish that there was multi-organ inflammation, meaning white blood cells going into the tissue where they don't usually live. And then the gold standard or the most accurate diagnostic test that you can use to diagnose myocarditis or heart inflammation is a biopsy. And in this case, the heart's biopsy showed white blood cells inside the actual tissue of the heart, which confirms a pathologic slide diagnosis or an autopsy diagnosis of myocarditis.
So ultimately, they found pathological findings in heart tissue, and they concluded that those pathological findings likely contributed to this person's unfortunate death. Um, and you agree with those findings, correct?
I do, that's right. So the myocarditis by itself, that doesn't necessarily lead to such a tragic outcome, but it's because you can treat inflammation there like you can treat it in other tissue. It's but like the author said, it was possibly a arrhythmia that really was dangerous to this particular patient, and so it's not easy to really establish a diagnosis of arrhythmia, and that's not unique to this particular hospital system. It's everywhere. You have to diagnose an actual arrhythmia, you have to have an EKG of it. And so it's just in certain times that because of the emergent nature of the medical care or how fast they needed to help the patient, they may not necessarily have a EKG to show you.
Right. And an arrhythmia, for those who might not know, is just an irregular heart rhythm, correct?
Yes, it's a heart rhythm that's not within the normal kinds of heart rhythms that we expect in kids.
Mhm. Right. And so this was all falling very close in time to her receiving a COVID vaccine. So we can't say for sure that the COVID vaccine was responsible for her death, but it seems likely that it contributed to these underlying causes that eventually led to her death. But if we want to really learn from this, right, we want to take this information, ask what can we learn from it, what do we still need to learn from it, and how does it fit into the overall literature so that we can use the overall literature to inform decisions moving forward. So you actually, I think, have a great perspective on what happened here and what we can learn from it. So do you want to elaborate on that?
Right. So that is touches upon the larger topic of sudden cardiac arrest as well. So I think the main take-home point for this article for people who aren't super big fans of science literature is to know basic life support and to advocate for that within your community. And so what that means is knowing how to do chest compressions and knowing how to help someone breathe and get a machine which is called an automatic external defibrillator to help them get rid of a bad heart rhythm if that is really what is making a particular patient unresponsive so that they can get to more definitive medical help. And so how myocarditis happens is that there's some inflammation coming from somewhere. So there's a lot of causes in adults and kids is different. The overall most common causes are not the same in kids versus adults, but some examples include infections, vaccinations, of course, toxins, sometimes drugs can do it, sometimes different parasites can do it, and then the tissue gets injured in some manner. So then the inflammatory cells, they do their job by trying to go into the tissue to try and clear out whatever caused the inflammation, but then it's the potential for inflammation and cellular damage then comes after that, which is the clinical thing that cardiologists call myocarditis, which is the inflammation of the heart muscle. And then you can also have inflammation of the membrane around the heart, which is called pericarditis. And in this particular article, they refer to this patient's diagnosis as atrial myopericarditis. So that's what they think, that there was inflammation in the heart membrane and the heart muscle both. And so how you can potentially have this not happen the next time, and that we're going this also benefits other causes of sudden cardiac arrest, because the sudden cardiac arrest is not only caused by myocarditis. There are genetic conditions, there are heart valve conditions, there are other conditions like cardiomyopathies. So situations in which the heart muscle doesn't squeeze well. But the overall thing that I think that it would be helpful for a general audience to take home is, in a situation where you suspect some symptoms of heart troubles, so specifically chest pain and shortness of breath, it would be the easiest thing to do to potentially diagnose myocarditis, because once it's found by a a medical professional, myocarditis has a long safety record of treatment and many good medicines to treat the heart rhythm problems and good medicines to treat the inflammation that it's associated with. But to early detection by looking for these symptoms, getting them to medical care, I think this would be my biggest take home for this article.
Mhm. Right. Yeah. So seeking urgent medical care as soon as symptoms such as difficulty breathing and chest pains arise would be an important lesson to learn here.
Right.
Yeah, I can't imagine how this family is feeling, but we as readers who don't have to experience the grief here, we can try to learn and teach others maybe what to do in these kinds of situations.
Right.
But the other thing to take home from this paper is that we have to contextualize it. It is a case report, and if people like certain anti-vaxxers, who I won't name, want to use this unfortunate death to further their agenda, then you have to really start asking the scientific questions. And the scientific questions, those scientific questions, namely being, does this case report mean that vaccines are dangerous? No. Does it mean that we should stop taking them? No. I don't think that those are reasonable takeaways from this, and I think that you would agree with that, right?
I'm on board with that.
And so what we can do when reading stories like this is to look at the literature and see what it says about things like this. So case reports are typically a weaker form of evidence. They are not useless by any means, but if we want to answer a question with confidence, we want to do a more robust study than a case report. That's actually what groups have been doing. For example, this paper, Hyperinflammatory Syndrome Following COVID-19 mRNA Vaccine in Children, a National Post-Authorization Pharmacovigilance Study. This is a pharmacovigilance study done, I believe, in France. And what it is a surveillance study, essentially, where a large population was looked at, and the authors were looking for events of multi-system inflammatory syndrome in children following both SARS-CoV-2 infection and COVID mRNA vaccination. And ultimately what they found, I'll put this link in the description so that you can read it in full, but what they found was that overall very few cases of this hyperinflammatory syndrome occurred following COVID mRNA vaccine in children 12 to 17 years old. This was compared to the rate following SARS-CoV-2 infection in the same age group. And just to back this comparison up, we also have had, for some time now, we've had case reports of multisystem inflammatory syndrome in children following COVID-19 infection and leading to their death. And this is another example of one such unfortunate case report where a 5-year-old child died of multisystem inflammatory syndrome following COVID. Dr. Han, I think we want to do the best we can as scientists and medical professionals, right, to reduce suffering. And I think when we see situations like a vaccine causing a very rare side effect that could result in a very serious outcome like death, then we want to ask the question, how can we prevent that in the future? And I think you did a good job answering that. Want to be able to look for the signs better and get help faster. But we also want to understand why this happened. What was the mechanism by which the vaccine caused this? And can we make a safer vaccine in the future? Or can we do something else? And that's going to require more research. I think that research is ongoing. We don't exactly know the mechanism by which this hyperinflammation happens. Different groups of researchers looked at the generation of autoantibodies following vaccination or infection when it comes to SARS-CoV-2. And they found that autoantibodies were generated in infection scenarios, but not vaccination. But that did not rule out autoimmune cellular responses. So we're getting closer to understanding that maybe it's not antibodies, but maybe it's autoimmune effects of cells that are causing these kinds of things. But we're not quite there in terms of understanding it completely. Yeah, I talked for a while, but do you have anything to add to that?
And I think there may be some pediatric cardiologists trying to work out part of the molecular mechanisms of
Yeah.
COVID vaccination myocarditis. So if I hear of that being published, I'll certainly share it. I think that the overarching points that you made are right on. So it's certainly good to take a case study like this seriously, but then also take the time to put this into the context of all the other studies that quite clearly show that the rates of MIS-C after vaccines are lower than the amount of bad things that SARS-CoV-2 infection can do, and put this into the context of further research that might be needed to help eventually figure out the mechanisms of MIS-C after vaccination and COVID vaccine myocarditis.
Yeah, so just to be abundantly clear, you know, no medication, no intervention, nothing in general is 100% safe. So the authors make a point in this case report that there have been, that as of September 2022, the number of COVID vaccine recipients in Japan was approximately 103 million for the second dose and 82 million for the third dose. And of those doses given, at least 800 cases of myocarditis and approximately 1,500 cases of myocarditis occurred after vaccination in Japan. That is a very, very low rate. Those numbers would be much greater if all of those vaccines were instead viral infections. And no doubt that vaccination is preventing those severe outcomes when people do get infected. As scientists and medical professionals, we don't want to look at any form of suffering and say that's acceptable. We look at this rare case report and we say, how can we do better? And I think how we do better is exactly what we covered here. We know the signs that someone needs medical attention and get them that medical attention more quickly. And as scientists, we can work more to understand the mechanisms involved, how to prevent them, possibly with safer vaccines or possibly just with medical intervention. But the answer is not to stop vaccinating. The answer is not to spread fear about vaccines. The answer is not to misrepresent data. Hopefully that message is clear here. Thank you, Dr. Han. This, I hope, has been informative to the audience, and I really appreciate you being here to help talk through this because I am not an expert in cardiology, histology, and anatomy. So really great to have you walk us through that.
And thank you for having me. And I am not a master of molecular biology, so I'll call you if I have those kinds of questions.
Appreciate that. Everyone watching, I hope you, again, learn from this. Links to these papers that we talked about will be in the description below. And please, if you have any concerns about your health, seek medical attention and take care.